Nurse Aide Practice Test free. Question 1. A client with a pulse of 112 beats per minute is experiencing Option A, normal heart rate. Option B, bradycardia. Option C, tachycardia. Option D, arrhythmia. The correct answer is option C, tachycardia. A heart rate above 100 beats per minute in an adult is tachycardia. This is above the normal range of 60 to 100. Bradycardia is a rate below 60. Arrhythmia refers to irregular rhythm, not rate. Tachycardia may indicate fever, pain, dehydration, or other conditions requiring reporting. Question 2. A client is having a seizure. The nurse aide should: Option A, put a spoon in the client's mouth. Option B, hold the client down to stop the seizure. Option C, clear the area and turn the client to their side. Option D, leave the client alone. The correct answer is option C, clear the area and turn the client to their side. During a seizure, clear the area, turn the client to their side to prevent aspiration and protect the head. Putting anything in the mouth can cause injury. Holding the client down can cause fractures. Question 3. Standard precautions apply to which bodily fluids? Option A, blood and blood products only. Option B, all body fluids, secretions, and excretions. Option C, only visible blood. Option D, only if the client is diagnosed with an infection. The correct answer is option B, all body fluids, secretions, and excretions. Standard precautions apply to all body fluids, secretions, and excretions, except sweat, regardless of visible blood, treating all clients as potentially infectious. Question 4. The nurse aide finds a client's oxygen saturation is 88% on a pulse oximeter. The aide should: Option A, document this as normal. Option B, report it to the nurse immediately. Option C, reposition the sensor and wait. Option D, increase the client's oxygen. The correct answer is option B, report it to the nurse immediately. Normal SpO2 is 95 to 100%. An 88% reading indicates significant hypoxemia requiring immediate intervention. CNAs cannot adjust oxygen, that is a nursing responsibility. While repositioning the sensor might be attempted briefly, reporting to the nurse is the priority. Question 5. When weighing a client, the nurse aide should: Option A, weigh the client at different times each day. Option B, weigh the client at the same time each day. Option C, weigh the client after meals. Option D, weigh the client before toileting. The correct answer is option B, weigh the client at the same time each day. Weighing at the same time each day, example before breakfast, provides consistent, accurate monitoring. Different times, after meals, or before toileting can cause variations. Question 6. The proper body mechanics for lifting includes: Option A, lifting with the back. Option B, lifting with the legs. Option C, twisting while lifting. Option D, lifting with arms extended. The correct answer is option B, lifting with the legs. Lifting with the legs, bending at the knees, keeping back straight, uses the strongest muscles and prevents back injury. Lifting with the back is a common cause of injury. Twisting while lifting puts torque on the spine. Question 7. When should a nursing assistant perform hand hygiene? Option A, before touching a client. Option B, after removing gloves. Option C, after touching client surroundings. Option D, all of the above. The correct answer is option D, all of the above. The CDC's 5 moments for hand hygiene include: before touching a client, before clean/aseptic procedures, after body fluid exposure, after touching a client, and after touching client surroundings. Removing gloves does not substitute for hand hygiene. Question 8. What should a nurse aide do if a client refuses isolation precautions? Option A, ignore the client's refusal. Option B, use restraints to keep the client in the room. Option C, educate the client and report to the nurse. Option D, discontinue isolation. The correct answer is option C, educate the client and report to the nurse. The nurse aide should explain the purpose of isolation and report refusal to the nurse. Restraints are never appropriate without a physician's order. Ignoring refusal or discontinuing isolation puts others at risk. Question 9. The nurse aide should wear identification. Option A. On their arm. Option B. On their upper chest at all times. Option C. On their back. Option D. Tucked in their pocket. The correct answer is option B. On their upper chest at all times. ID badges should be worn on the upper chest at all times for easy identification by clients, families, and other staff. Visible ID builds trust and meets safety standards. Question 10. The nurse aide should speak to a client who is hearing impaired by Option A. Speaking very loudly. Option B. Speaking slowly and clearly while facing the client. Option C. Writing everything down. Option D. Asking a family member to translate. The correct answer is option B. Speaking slowly and clearly while facing the client. Speaking slowly and clearly with normal volume and facing the client allows lip reading and visual cues. Shouting distorts sound and is uncomfortable. Writing everything down may not be practical. Question 11. What is the correct procedure for taking an oral temperature? Option A. Place thermometer under the tongue, close mouth. Option B. Place thermometer under the tongue, breathe through mouth. Option C. Place thermometer between the teeth. Option D. Place thermometer on the tongue. The correct answer is option A. Place thermometer under the tongue, close mouth. The thermometer must be placed in the sublingual pocket with the mouth closed. Breathing through the mouth or placing on the tongue leads to inaccurate readings. Placement between teeth risks breaking the thermometer. Question 12. A client complains of chest pain. The nurse aide should Option A. Give the client an aspirin. Option B. Have the client lie down and call the nurse. Option C. Walk the client to the nurse's station. Option D. Wait to see if it resolves. The correct answer is option B. Have the client lie down and call the nurse. Chest pain requires immediate medical evaluation. Have the client lie down and call the nurse immediately. CNAs do not administer aspirin. Walking may worsen the condition. Waiting could be dangerous. Question 13. When taking a client's oral temperature, the nurse aide should place the thermometer. Option A. Under the tongue. Option B. On top of the tongue. Option C. Between the cheek and gum. Option D. Under the arm. The correct answer is option A. Under the tongue. The sublingual pocket under the tongue is the correct placement for an oral temperature. This area provides accurate core temperature readings. Placing on top of the tongue or between cheek and gum does not provide accurate readings. Under the arm is the axillary method, not oral. Question 14. The nurse aide's responsibility with advanced directives includes Option A. Helping the client complete advanced directives. Option B. Honoring the client's wishes and informing the nurse. Option C. Making decisions for the client. Option D. Explaining advanced directives to the family. The correct answer is option B. Honoring the client's wishes and informing the nurse. The nurse aide must respect and follow advanced directives and inform the nurse of any issues. The aide does not assist in completing advanced directives, make decisions for the client, or explain legal documents to the family. Question 15. A client with mental health issues is refusing medication. The nurse aide should Option A. Force the client to take the medication. Option B. Report the refusal to the nurse. Option C. Hide the medication in food. Option D. Tell the client they will get worse. The correct answer is option B. Report the refusal to the nurse. Medication refusal should be reported to the nurse. Forcing, A, or hiding medication, C, is unethical and illegal. Threatening, D, is not therapeutic. Question 16. The nurse aide notes a reddened area on a client's sacrum that does not blanch, turn white, when pressed. The aide should Option A. Document it and turn the client. Option B. Massage the area to increase circulation. Option C. Apply heat to the area. Option D. Leave it alone. The correct answer is option A. Document it and turn the client. A non-blanchable reddened area is a stage 1 pressure ulcer requiring immediate documentation and repositioning. Massage is contraindicated. Heat is not indicated. Question 17. The client's call light should always be placed. Option A. On the bed. Option B. Within the client's reach. Option C. On the client's right side. Option D. Over the side rail. The correct answer is option B. Within the client's reach. The call light must always be positioned within the client's easy reach to ensure they can summon assistance when needed. Placing it over the side rail or in a specific direction doesn't guarantee accessibility. This is a critical safety measure to prevent falls when clients try to get up unassisted. Question 18. Which approach is best for a client with dementia who becomes agitated during personal care? Option A. Use a firm tone to assert authority. Option B. Provide simple explanations and allow choices when possible. Option C. Complete care quickly regardless of the client's response. Option D. Skip the care altogether. The correct answer is option B. Provide simple explanations and allow choices when possible. Simple explanations and offering choices. Example, would you like to wash your face first or your hands? Reduce agitation and maintain dignity. A firm tone can escalate agitation. Skipping care is not appropriate. Question 19. The nurse aide is assisting with morning care. The client prefers to perform their own care. The aide should. Option A. Perform all care for the client. Option B. Allow the client to do as much as possible independently. Option C. Rush the client so they finish quickly. Option D. Leave the room and return when the client is done. The correct answer is option B. Allow the client to do as much as possible independently. Promoting independence is a core principle. The nurse aide should encourage and enable the client to perform as much self-care as possible while providing assistance only where needed. Performing all care undermines the client's abilities and dignity. Question 20. When assisting a client to walk, the nurse aide should walk. Option A. Behind the client. Option B. Next to and slightly behind the client, holding the gait belt. Option C. In front of the client. Option D. Far to the side of the client. The correct answer is option B. Next to and slightly behind the client, holding the gait belt. Walk next to and slightly behind the client on the weaker side, holding the gait belt to provide stability and catch them if they lose balance. Walking behind doesn't allow seeing the client's face. Walking in front is unsafe. Question 21. Which activity is most appropriate for a client with dementia? Option A. Complex puzzles. Option B. Simple folding tasks. Option C. Reading medical journals. Option D. Watching educational films. The correct answer is option B. Simple folding tasks. Simple, repetitive tasks like folding towels provide a sense of purpose and are appropriate for clients with dementia. Complex puzzles in medical journals are too challenging. Watching educational films may not be engaging. Question 22. When counting respirations, the nurse aide should. Option A. Tell the client they are counting breaths. Option B. Count while appearing to take the pulse. Option C. Count for 10 seconds and multiply by 6. Option D. Count for 30 seconds and multiply by 2. The correct answer is option B. Count while appearing to take the pulse. Counting respirations should be done without the client's knowledge because conscious awareness can alter breathing patterns. The nurse aide should keep their hand on the client's pulse site while counting breaths to disguise the activity. Counting for 10 or 30 seconds is acceptable for regular respirations, but disguising the count is key. Question 23. When applying a gait belt, the nurse aide should place it. Option A. Around the client's chest. Option B. Around the client's waist, over clothing. Option C. Around the client's hips, under clothing. Option D. Around the client's neck. The correct answer is option B. Around the client's waist, over clothing. A gait belt should be snugly around the client's waist, over clothing, not bare skin. Not over the chest, restricts breathing, not under clothing, skin irritation, and never around the neck. Question 24. Normal adult respiratory rate is: Option A, 8 to 12 breaths per minute. Option B, 12 to 20 breaths per minute. Option C, 16 to 24 breaths per minute. Option D, 20 to 28 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. The normal adult respiratory rate is 12 to 20 breaths per minute. Rates below 12 indicate bradypnea, above 20 indicate tachypnea. Both require reporting to the nurse. Question 25. A client with dementia is eating slowly and forgets to chew. The nurse aide should: Option A, feed the client quickly. Option B, provide verbal cues to chew and swallow. Option C, puree all food. Option D, remove the food after 15 minutes. The correct answer is option B, provide verbal cues to chew and swallow. Verbal cues, example, chew your food, help the client eat safely. Rushing increases choking risk. Pureeing may be necessary for some but not all. Removing food after a short time may result in inadequate nutrition.